Welcome all of you. Muy bienvenidos. It's going to be a good year. It's a pleasure to have you here. Welcome to those of you who haven't been here before. We do a monthly People's Policy series, which this is, and I want to wish all of you something positive. So I hope 2024 brings you all um, lots of opportunities and gives us all an opportunity to collaborate as well. I also hope we can all step away from those things that no longer serve us. So thank you for joining us this morning. And we are going to talk about 2024, which is what we are here at Maryland Latinos Unidos are fully embracing. What might change look like in 2024? As we begin the year, we're looking ahead to a number of possible challenges and opportunities on a whole bunch of different levels. This is, Latinos in Maryland we're sort of the newbies in some ways, but as it impacts everyone, it will impact us in certain ways. So let's think about on a national scale. It's a presidential year. We are going to have an election cycle. And what usually happens is the candidates will suddenly think about, oh, we need to talk to Latinos, and they'll carry the Latino vote, but Latinos are a little burned out. So when we think about it from an advocacy perspective, the community doesn't want people to just come to them when it's an election cycle, right? What's happening the rest of the time? So what could this mean for Maryland? Are Latinos going to come out to vote? Will Latinos be a swing vote? And then statewide, we're also facing a number of big picture items, right? The financial restrictedness, I think we're going to see a little bit of that moving ahead. So what does that mean for Maryland Latinos Unidos? What does it mean for all of us as, leaders, community leaders, and for Latinos and Latina community members in particular? We know the governor said he wouldn't raise taxes. He didn't raise taxes, but we are also fully aware that the surplus we've been enjoying is now in what they call a general fund structural deficit. So, we're talking that by the time he leaves office, the deficit will have supposedly increased to 1.3 billion. And then after, it is likely to go up to 3 billion. Well, that is a huge structural gap, right? It's something that everybody's thinking about. So what should we focus on as we do our work as Latino advocates? What are our priorities? We're going to have to set priorities because it's going to be harder. It's going to be more competitive. But I always say, when things get like that, let's grow the pie. Why limit ourselves to what is in this situation? Let's make the pie bigger. I think it's probably likely that legislators and the executive are going to want to tighten our collective belts, cost containment. So how will that impact us? And yet still, like I said, continue to push our agenda forward, because part of this People's Policy series is to start setting positions and priorities so that we can make clear what our asks and expectations are. And then we also have to think about globally, right? What are we facing in 2024? Because I don't think I'm alone in this, but it just feels very disruptive. We hear a lot about wars, Ukraine, Israel and Palestine, and Russia and Ukraine, excuse me. But we're also looking at things like climate change, and a lot of us are advocates on that front and on environmental justice, and it's impacting our health. So droughts, wildfires. I mean, remember the Canadian wildfires this summer? What's going to happen in 2024? We've had flooding, we've had rivers overflowing, we've seen migration of animals, and now we're seeing migration of people. And everybody's trying to survive in a very changing environment, literally. So does that make our community more vulnerable? How has it made our community more vulnerable? And what kinds of actions can we take collectively, to mitigate potential crises that, I don't think Maryland is there, but we're part of this, right? There's places where it's really challenging. So I think we need to think about resilience and adaptation, mitigation, all those good things, because our community health is. We're going to discuss some of these priorities, some of these issues moving forward, and how we can align these with the broader needs of what's going on statewide. And let's talk as allies. Let's figure out how we can partner to build a more equitable Maryland. Um, I think we also should raise some of the sticking points that'll make things challenging. That's always important. And any opportunities that we see. So I have two lovely colleagues with me today, Kelly Umaña. She's a key member of MLU's Health Equity Team. She holds the role of Senior Specialist, Evaluation and Monitoring. Evaluation and monitoring for us is really critical. We are sort of in a continuous process of doing that to inform policy, et cetera, but also to gather information and collect data to the extent that we can, because it's challenging here in the state. Any of you who do research in that space, you'll more than likely have bumped into, how shall we say, roadblocks. And then Carlos Orbe Jr., he is our MLU's Public Affairs and Communications Specialist, and he has the grace to attend all these hearings in the Senate and the House and state delegation. I'm sorry. And, he really keeps us on top of what's going on. We go through this whole process of deciding beforehand, and that's part of the conversation we're going to have here today. How did we get to this, our decisions? Both Carlos and Kelly play vital roles in helping us set our strategy and planning. They're right now leading efforts to construct our framework. So what I'd like to do is now start with maybe some introductions. Welcome, Kelly, Carlos. Why don't you two introduce yourselves and share a little bit about your goals for 2024 at MLU. Let's start with you, Carlos.
I'll let Kelly go first. Ladies
Ay,
first.
mira.
What
He's a gentleman, caballero.
Hi, everybody. Thank you so much, Gabby, for this opportunity. My name is Kelly Umaña, and my pronouns are she, her, ella. I'm very excited to be here to talk about what are some things that we're looking towards for 2024. Just a little bit about me. I'm a public health practitioner. I've been working in public health for almost 10 years at this point. It is my bread and butter. Like Gabby said, monitoring evaluation is incredibly important to measure impact, measure outcomes, and measure how we are creating opportunities and programs to really address our communities that we're looking to serve, and we're doing that proactively in a way that we can scale our work to larger communities. I am all about, for me, growing up, I didn't know I was a community health worker, a promotora de salud, my entire life for my own family until I learned about the profession. And so for me, being a certified community health worker has really centered why I went into public health in the first place. In terms of my goals for 2024, and I don't want to say my goals, I think it's more of the goals of our coalition. Just for some context, I administrate the Latino Health Equity Alliance Coalition, also known as LEAH. We started off in Malvic through the Mid-Atlantic Latinx Vaccine Equity Coalition, which was really to bring partners across the state of Maryland, serving Latinos, serving our communities that were highly impacted by COVID-19. During the early onset of COVID, there weren't enough resources for Latinos, and we were all doing different work in different parts of the state, but we weren't coming collectively to have these conversations. And so as we continue to see the pandemic I don't like to say this, that we're receding from post-pandemic, or we're in post-pandemic world, but we're really seeing the impacts of the pandemic very much. It shed light to all the things that were happening in our community that were already even happening, just worsening before the pandemic came about. And so the Latino Health Equity Alliance, the mission is to promote equitable social, economic, and environmental conditions to achieve optimal health, mental health, and well-being for all, with a focus on Latinx communities across the state. It's comprised of over 20 partners across the public, private, nonprofit, community leaders sectors. It's a really great way to think about, as we're thinking about social drivers of health, as we're thinking about looking at our communities holistically, especially Latinos, this coalition has really come together to really think about priorities for this next year. We also have our quarterly meetings with the Secretary Laura Scott, who's the first Latina to be in that seat, which is incredibly amazing. And she has previously called us her sounding board for what's actually happening in the community for Latinos. And so really the priorities for this upcoming year is something that I think everyone is thinking about, which is our mental health, especially among our adolescents. We are seeing, as Veronica Cool has said before, our girls are needing so much support. Our communities are needing so much support. Our youth have been isolated for so many years at this point, and how do we help support them, and how do we build capacity from representation to the workforce to access to entry point? So what does that look like? Community health workers is so critical. A lot of the funding that we have seen that we received during COVID-19 is going away. And a lot of the funding that was provided for community health workers came from those funds that came from the state of emergency and the bills that were passed during this time, both federally and locally in the state. And maternal health is a huge, critical, still a huge gap in our communities. While it is a great achievement that our state has been so progressive and has really ensured that our immigrant communities have access to maternal health care through the Healthy Babies program, but there's still lack of information. Many organizations know about it, but the community doesn't know about it. How do they navigate these systems? Are providers prepared to see a patient for the first time that hasn't had any type of healthcare before in this country? And are they prepared to be able to provide equitable and quality care? So what does that look like? And language access. It should not be a privilege. It should not be a privilege to have information in your language. It is a basic necessity in our communities, and we're still seeing so many issues around that. For the Healthy Babies program, we let the state know that they weren't providing accurate information in Spanish. And so they were able to update a lot of their information internally to ensure that it reflects the communities that are being served and ensuring that it's reaching them, but there's still so much need for that. So those are some of our goals for this year, hopefully to move these things forward and ensuring that we're able to think about what our Latino communities, what a healthy community looks like, and how we support that through the coalition.
You started really small as aspirations there, Kelly. World peace. Carlos, it's your turn. Please introduce yourself and share with us where we're going.
Yes. Good morning, everyone. As stated before, my name is Carlos Orbe Jr., and I am the Public Affairs and Communications Specialist for Maryland Latinos Unidos. First and foremost, absolutely giddy at the fact that I'm allowed to be able to present before all you leaders and advocates in your own right. And some background information about me. I have my master's in policy and public management. I had a legal background, and now I get to bring all of my many hats to MLU. So enough about me. Maryland Latinos Unidos, right? I believe we are more than a nonprofit organization. I think it is a united family with a mission to break zip code barriers for equal opportunities. And with that being said, we focus on community, leadership, and professional development, advocating for these resources to fund programs that can empower our underserved communities. So I think this session, what we're gearing towards are our pillars. That is a focus on leadership and professional development. And, the way I consider that is this. We want to help young Latinos, Latinas become leaders in local government, start their own small businesses, work in nonprofits, and even become social entrepreneurs. I think that it's about time that we stop looking towards these leaders that don't look like us, that sometimes might not have our best interests at heart. So we need to invest in that future. The 2020 census that I need to bring up today, I think revealed an ugly truth of the underrepresentation of Latinos in Maryland. And this makes it all the more important and crucial to invest in Latino youth who are a significant part of our state's future. So let's focus on education, right? And I know it's morning, you don't want to hear stats, but I'm going to bring them to you. 31% of Latinos under 18 make up nearly 1 million public school students, but with dropout rates, they're now around 28%, and a majority of them are young boys. Higher graduation rates offer brighter futures. Education with a focus on language proficiency, as Kelly stated, is key to a more equitable and prosperous future for the state. I think this benefits government agencies seeking that language access. So by investing in these programs, Maryland, can foster that inclusivity. Now, I am going to go into in-depth bills a bit later on, so I'll spare you right now. But switching gears, I think our second focus is at the core of our mission, I believe, lies a profound commitment to health and well-being, as Kelly was stating earlier. Every 30 seconds, a Latino child in Maryland comes of age 18. That is a crucial time for their mental and physical development. So I believe it's our responsibility, nay, our obligation, all right, to champion legislation that prioritizes their mental health and overall well-being. I think the Access to Care bill is a great example of that. That was spoken about at the Maryland Legislative Latino Caucus. It's the priority of CASA. It's in full swing right now. But equally significant to the mental health and overall well-being is our environment, right? Especially our marginalized communities. Serious environmental issues disproportionately affect them. And if you all would indulge me, I need to tell the story because it baffled me. Everyone was up in arms about the Flint water crisis, and as they should be. But right in our own backyard in West Baltimore, predominantly Black and brown communities faced water contamination issues that raised health concerns due to E. coli contamination. Now, this is important for us to put on our legislative hats right now, because how did this happen, right? The Maryland Environmental Policy Act, that's MEPA, was supposed to protect our environment and health, but it became less effective over time due to rule changes, leaving critical decisions unaccounted for. Now, a solution was the House Joint Resolution, which aimed to strengthen MEPA and prevent environmental issues like water contamination, but it didn't pass. So once again, we're putting the responsibility on the Maryland General Assembly, and this is why this education is so important. So with this bill, HB 166, the Reclaim Renewable Energies Act, this promotes cleaner energy sources, reduces pollution, and protects the environment, which is crucial for our future health and well-being. Now, our last pillar is a focus on investment for Latina economic growth. Couple statistics, right? In the US, 70% of Hispanic entrepreneurs rely on personal savings as their primary source of capital. Despite their strong revenue growth and credit performance, they often face challenges in loan approvals. Now, these disparities in approval rates are just one part of a broader issue. Housing is a critical concern for the Latino community. I plan to talk later about Governor Moore's housing package in Maryland that I believe tackles the issues head on. And I'll end this answer by posing a question to you all. Why are we here? Why is this all urgent? To me, I answer that every day because I think more children are at risk every day, from lack of a fair education to no health care to lack of economic opportunities. I think it's about time that we support these bills, make our voices heard, and push our leaders to prioritize these important issues. And, you know, I'm elated at the fact that I can be here today with a total of 55 people. This is one of the largest policy series I think I've seen, and it's just a pleasure to be here. So thanks.
There we go. Sorry, I had to unmute myself. I always still have these problems. Thank you, Carlos. Thank you, Kelly. As you can hear from my very young staff, we are developing strong leaders for the future of the state. And when I retire in 100 years, I will hand over gladly my leadership to these young folks. But we also put on the table a whole bunch of different issues. There's a lot going on. In some ways, we're playing a lot of catch up. And in other ways, we're trying to do a lot simultaneously. So we learned a lot about leveraging. So I wanted to talk with both of you about process and how you guys went through thinking about how you were putting all this agenda together. You both do a whole host of things. Kelly, you administer the Latino Health Equity Alliance, which kind of helps us shortcut talking to grass tops and government leadership about how we address health equity. That's a great resource, and it came through an evolutionary process. And you, Carlos, you've been amazing going to these meetings with the Environmental Justice Coalition, the Community Well, English for English language learners, different Board of Education things, criminal justice, housing. You're everywhere. So tell us a little bit about how you do your planning and what are the pieces that you're putting together. And then also maybe a little bit what's missing that could be helpful.
Yeah, I'm happy to talk about the Latino Health Equity Alliance. So one of the things that we continuously talk about in public health and health in general, I mean, healthcare is 20% of our whole health. Back to what Carlos, our environment, our social and community context, what does that look like? And so one of the most important things that we've specifically established within LEAH is ensuring that we bring in the voices of different perspectives that are serving our community, not only through the social drivers of health, such as housing, legal, health, insurance, research, et cetera, but also the varying levels of where communities are being served. For example, there are some folks that are serving communities behind the scenes that are not really entrenched on the day-to-day social services, but are looking for different ways to support through programming. But we're also ensuring that our community leaders that are constantly on the ground, hearing what's happening in the community, what they're seeing and what's happening. We don't have all the eyes and ears. What's incredibly important is that collective voice that comes together. So through the Latino Health Equity Alliance, we usually have facilitated conversations. What are we seeing in the field? What's happening in the community? Through varying, I believe LEAH is coming up to what, 2 years now, Gabby? That's crazy to think about that. But throughout these conversations, through individual conversations that we have with our partners, it's not just about also coming together, but building those relationships and ensuring that folks know that this is a space for them to ensure that their voices are heard, that no one's idea or no one's experience, regardless of what it is going to be, questioned. And so what we like to do with through building partnerships and building relationships with folks is we have very trusting one-on-one conversations with our partners. We, ensure that they understand, we have a mutual understanding of where we are in this process. What does this look like? What does this mean for you? What's beneficial? What's the benefit between both organizations and our community? Always at the center of our community. Unfortunately, as we're constantly putting out fires, and especially within the healthcare system, especially within our social services, like it's really hard to understand what it is that we're doing every day until you have this one moment. It's like, oh my gosh, you look at a wall, like you're at a wall, you're at a crossroads. Like, how can I support my community? I've exhausted all of my resources. I don't know what else to do. And this is a space for those folks to know that there is a way that we can make larger change. All of us are doing work day to day. But what we sometimes often don't realize is that through those experiences, we can make significant changes both at the state level to ensure that what you're doing isn't impacted by the complicated systems that have been put in place for our communities, that we can ensure that those systems change, that they reflect the needs of our community, reflect the representation of our community. So through the Latino Health Equity Alliance, it's really a space for having these conversations. We have that relationship with the secretary where we have been able to bring forth agendas. We've been able to bring forth questions where that she can address. Holding them accountable is so critical, because we can say these shiny numbers. Oh, we've reached these folks. We've done this, we've done that, but oftentimes we don't hear the stories of what has happened to get to that point. What are still the challenges that we're facing? What are the issues that our communities are facing every single day that we might not be seeing? So let's celebrate the wins, yes, but let's also ensure that every step of the way, it's a community-centered perspective. And what are the gaps that we're still not touching? Such as language access, like I mentioned, to think that this program was developed for our immigrant communities who oftentimes have limited English proficiency, lacked access to that information in their respective language. So the Latino Health Equity Alliance, what we at MLU, we strive for is ensuring that if who's missing at the table, and if that table is missing so many folks, or if it's not really moving towards where we want to achieve, let's break the table and let's make it bigger. Let's see how we can ensure that every single voice is brought into the conversation. We ensure that every stone is not left unturned, that we look at every piece of things, and very much looking at everything in a holistic way, and building meaningful relationships with our partners is another critical point.
I'm sitting here talking. Yeah, I think that's totally on point. And I love it. I love how it's evolving and evolved. And it will continue to do so. In many ways, LEAH is a very new process that we've developed. And that we're just barely figuring out the full potential of it. It gets me to Carlos. Now, Carlos, you've been working on all kinds of collaborations that are new, that we don't administer, and really take a lead role in communications and bringing in the Latino voice to the coalitions. Tell us a little bit about your processes and how you go about making decisions. Because I mean, at one moment he's in Montgomery County doing, something with the county council. Next thing I know, he's with the legislature on the Senate side, and he's moved on. So he covers a lot of ground. And Baltimore.
Well, thank you so much for that. I think prioritizing the agenda for the year is one of the most crucial steps. I think, luckily for me, I was working with the Department of Legislative Services, as you said, on the Senate side. I was in the Judicial Proceedings Committee, and they pretty much structured my thought process of looking at these things from a macro and a micro perspective. And luckily for me, with being a public affairs and communications specialist, I think that they both complement each other in many ways. I think that the public affairs is the macro outlook, and the communications to see, all these micro communities, these niche areas that they're trying to promote. Because like Kelly said, I believe community and community leaders are the voice of the people. Like these boots on the ground, eventually it's going to come up to larger themes and understanding them. And the good thing is, maintaining a pulse on the socials through communications is like, you get to see where is the public at right now? Where is the mindset? How do all these moving pieces work together, and where will they meet? And I have to cite statistics and data. I know that the Census Bureau has reached out to us personally because there is not enough information on our population to answer questions outright. So that does involve going to these community leaders, these street level bureaucrats, and engaging with them. I do want to highlight a couple of the organizations that I'm working with: the Maryland Legislative Latino Caucus, the Mid-Atlantic Justice Coalition. They are responsible for the environment upkeep. We are meeting with state representatives, local leaders. As you said before, the community well. I am privileged to be amongst true advocates that are really looking, as Kelly is saying, like for language access. And I think me being able to look at it from a macro perspective, these things aren't distinct or separate. If we were to look at it through a new lens, a lot of these questions answer each other. I just wanted to cite what I said earlier, education with the government agencies. There right now is a need for translation services. There are bills that are promoting language access for young students. So in the future, we don't have to worry about this. I also do want to shout out the Leadership, Sustainability, and Innovation programming led by Al Marie that's on this talk as well. She is inviting these community leaders to organize themselves and create a programming that's going to supersede anything that we've done in the past. It's more of that organized front. So that is how I truly prioritize the agenda for now.
So we have a question in the chat related to the Maryland General Assembly session. Any priority bills either one of you want to mention, or not so much a bill yet, but something that's cooking that we should be aware of, and how we can all make a difference. Obviously, so since we work in diverse areas, the domains that Carlos said, we're a little picky just because we don't have bandwidth. But there is a lot. So there might be different types of allyships that we can make. That there's more detail in the question, bills that are close calls or whether they might pass and who are the swing voters. Okay, we need a full analysis of what is going on in the Maryland State Legislature, what we're going to do. Carlos, why don't you talk a little bit about it? And then Kelly, maybe talk a little bit about your work on the community health workers.
I'm gonna post the priorities here. While I do that, Kelly, would you answer that first, just so people have context when I'm referring to mine?
Yeah, absolutely. So for community health workers, as I mentioned before, there is a significant need for sustainability and financing for CHWs. Unfortunately, a lot of times organizations are dependent on grants, on operational funds as much as they can to sustain community health workers. Right now, we are one of, I think, 15 states that don't reimburse community health workers through Medicaid. Medicaid provides healthcare access to our most vulnerable communities, our most underserved communities, and community health workers already working in some of these healthcare systems are often not either paid well, or they're let go from their jobs because there isn't financing. So some of the work that we're hoping to achieve through right now, I believe there's a study that was put into a dental bill, and I don't have it off the top of my head, but what they're trying to do is look at what is the return on investment? What is the funding what does a Medicaid reimbursement look like? So hopefully through that, there can be some more informed decisions around bills and priorities to ensure that CHWs can get reimbursed through Medicaid. This will help healthcare organizations such as hospitals, federally qualified health centers, private clinics that may be interested in hiring community health workers within their own clinics that serve Medicaid patients. This will give them an avenue to be able to hire and retain community health workers through Medicaid reimbursement.
And so what Kelly is talking about is one of those things that we have in the cooker that we're looking at, thinking about. So we're sharing it with you a little bit in advance before we actually have a bill. So we're still in that early phase, but I'm glad she brought it up, because it really, we have a lot of gaps in workforce and the community health workers, and there's a lot of need. And the community health workers play such a critical role in community leadership and in interfacing between the healthcare services and the public health and the community itself. They're trust builders, et cetera. So they help a lot. It's a little challenging. The frustrating part is there's no real mechanism for the nonprofit side of it. It's mostly for the organizations that can deal with all the paperwork and case management related to HIPAA. So that's just something that's under consideration as well. That makes it a challenge. Anyway, Carlos, tell us about the document you just shared.
Yeah, and I just want to give a shout out to that question, and I thank you for asking it because this is one of the initiatives that I'm going to be personally working on. I think our unveiling is going to be next week about these specific questions about voting, like the patterns, who's supporting us. I'm going to be creating a Reels project that's going to take a deep dive into these policy priorities, this legislation that we're working on. In reviewing the political terrain that we're looking at right now, even citing statistics from the Pew Research Center, there is a significant distrust between the people and its government. And who do they turn to in times like that? It is the nonprofits. It's these community leaders that are here no matter the weather. So there will be more on that. But I think regarding policy priorities for this year, I think I want to start with education. And I'm going to be citing a brief overview of these. And if you want to talk more, please, let's connect. But HB 50, Commission on History, Culture, and Civics and Education. This is actually establishing a commission that makes recommendations to the State Board of Education, the State Department of Education, to further the discovery, interpretation, and learning of the history, culture, and civics of the United States and Maryland. It's important to highlight that we are living in an unprecedented time where technology is running rampant and new discoveries are being found every day. I think it's about time that we reassess these textbooks and teaching materials that actually reflect us in them. Going further, SB 161, that is the community schools alteration. This legislation revolves around modifying community schools in Maryland. Community schools are a special type of educational institution that collaborates closely with their local communities to offer additional support and services to students and their family. So I guess the ultimate goal is improving academic performance and overall well-being. And they do that through changes in funding, priority of high need areas, needs assessment, community school coordinator, wraparound services, parent and community engagement. The next bill that I'm looking at, and please refer to the sheet that I gave you. I know this is a lot, but all these are important in their own way. SB 116 is public schools, inclusive and diverse English language arts, right? And this is the development of content standards and implementation. We believe that each county school board has to create curriculum that guides and matches these new standards of diversity, equity, inclusion, tolerance, and belonging. And many of these things impact the Latino populations in a very strong way. I believe that there is the Live Near Your School program, and that addresses funding for many minority students in the area. Now, if we want to take a look at community bills, there's one called SB 308, that is the Housing and Community Development. It's a just community designation. And this bill is about creating something called just communities that are special areas that the governor can designate on certain criterias. The factors include whether the area has a history of racial segregation, unfair treatment, or environmental hazards. If an area meets these criteria, then they are deemed a just community, and that comes along with certain benefits. There is the Department of Housing and Community Development, SB 98, that delves into food desert studies. And what this initiative is, it's all about helping people and businesses, nonprofits, and food deserts offer healthy food options and support local farmers. It's like a plan to make sure everyone has a chance to eat better, even if they live in areas that don't have many good food choices. Now, here's one that I think really stands out, and this is Governor Moore's 2024 housing package. And, I think it's important to point out that Maryland is facing a serious housing crisis, but no one really understands the history behind it. What are the figures? Where's the data? And so Maryland is short in constructing 96,000 housing units, and the shortage is only growing. Over the past decade, they haven't been building enough houses, adding only about 5,600 units per year on average. This is a huge problem because it's making it increasingly difficult for people in Maryland to afford homes. The cost of building new houses has also gone up due to factors like inflation and rising interest rates. I think that this housing shortage is impacting the Latino population, among many others, because no one can afford a home. I know there's a stunning figure that I can share with you. Between October 2021 and October 2023, the income needed to afford the average price home in Maryland doubled, making it out of reach for many. So, all this to say is that I believe that this package is comprehensive, and if it's successful, it could significantly improve housing conditions in the state. I know with housing and wellness, I think my priority bill for that is going to be the Reclaim Renewable Energies Act. But there's also one, HB 184, that's Public Health and Maryland, Healthy Maryland Program Establishment. And this legislation aims to establish a single payer healthcare system in Maryland. It allows access to healthcare, privacy protections, cost reduction, health equity. And, I want to say that despite these potential benefits, undocumented individuals may still face challenges related to immigration status, including their eligibility for federal programs, which could impact their certain services and benefits that they would otherwise need. And, I think, as Dr. Limbus was talking about, I'm trying to bring MLU into the criminal justice, social justice initiatives by joining groups like MAJOR, the Maryland Alliance for Justice Reform. They've been responsible in targeting juvenile justice bills. I know I had the pleasure of working on the cannabis recreational bill before my time here at MLU, and that was how I handled the expungement process framework that has a lot of Black and brown populations within their prison system. Getting those out and working on recidivism and getting them the right education needed to make leaders with that experience that come from these communities that are at most risk. That's what we need right now. So I hope that answers your question. Just for time's sake, let me know how we can get in touch. I look forward to speaking to anyone who reaches out.
Sorry for the pauses. I'm trying to go between the chat and the come back to take my mute off. Carlos, you raised so many issues, and it's kind of hard to say. They're all important, right? But I think part of the challenge we have is it's going to be more generalized in terms of what's going to be the hottest thing on the plate that's likely to get exposure. That was part of the question as well. And I only say that, from the Maryland Nonprofits Legislative Priority Series, if we heard anything from the delegates and the senators, it's that on both sides of the aisle, you said it's, we're in budget deficit mode. You heard me mention at the beginning of my little monologue there that we're looking, by the time the governor leaves, our deficit might be up to 1.3 billion. That means they're being very picky what they do. But all the more reason why this conversation is so important, and that we keep pushing for these issues to get prioritized as part of it and not exclusionary. And as I said at the beginning, when you start looking at shortfalls, it's just as important not just to think about cuts, cost containments. That's critical. Efficiency, critical. Productivity, absolutely. Impacts, yes. But you also have to think about need. And that need is why we're here in the first place. So I would say let's just keep pushing on. Sorry, I get excited. So we actually went a little bit longer on some of these questions than I thought. So maybe what I'll do, I'd like to bring up the issue, because I also mentioned at the beginning, talked a little bit about the election cycle. And to win, you have to turn out voters. Voters are burned out. it's only being reached out to when there's an election cycle. So that's why I'm saying our priorities need to like be front and center. We need to be clear what they are. And then when they come around to us, like, what did you do for the community? And I think as a sector, as a nonprofit sector, as Latinos representatives, it's important to be, like say something, right? This is harming our community. This is a priority as well. These issues, whatever these is to each one of us. But having said that, what do we think? This I want to open up for all of us to talk about. Please raise your hand. And maybe actually, I'd like to hand it over to Veronica to get us rolling. But what do you think this is going to mean for Maryland? Do you think that there's I mean, this is a strange election cycle. How do we manage these moods and voter suppression and voter education? Like, will Latino voters be the swing vote? I feel like I'm on NPR or something. Go ahead, Veronica.
Good morning, everyone. Good morning and Happy New Year. Feliz año, mucha salud, mucha prosperidad. And Gabriela, thank you for getting us started with such a strategic session. I'm happy to see the questions. I'm happy to see the interactions, happy to see just how we're thinking intuitively in the chat about what's next and how do we become more unified and strategic, because I think we haven't said it, but there's not enough of us to go around, and we need to be really smart about how we do the work, and we need allies. It's not just about Latinos being a marginalized population. We have a lot in common with other groups. So I'm happy to see so many partners. We often don't sit at the table. We don't even know where the room is, let alone a conversation is happening. So I think having this legislative focus, as Carlos is describing, bill after bill after bill, and pretty much spoon feeding us where we have to show up, how we have to, campaign, legislate, advocate, testify is key. So to really basically answer your question, Gabriela, we have to show up. And we have to mobilize our people to show up. And I'm not talking politics. Please, please, please hear us loud and clear. One of the reasons we founded Maryland Latinos Unidos was to be nonpartisan. Not really going to go down the path of Democrat, Republican, Independent. We're not even there. That's not the point. The point is we have to show up to make sure that our voices and our needs are heard. The fact that language access is a federal mandate and our people are still denied access because there's no interpreters available. There's no reimbursement for the interpreters. So to really drive the conversation, we need every single person that's on this chat, every single person that is here to coalesce, convene, and work together towards getting these bills passed, propose new legislation. We have many friends in legislation. So if there's something we're not touching, if there's something that's maybe too polarizing or too difficult to get through, but you have something simpler, easier, better, innovative, please bring it forth. Send us your projects. And if you need letters of support, if you need testimony, leverage us. I mean, we are reaching the entire state, and thanks to Gabriela, the country. We're all over the place. So we have allies that can get behind legislation and projects to really, truly make change. That's the first step. I appreciate that every one of you is in your backyard doing beautiful work, no disrespect, but we could do it bigger. We could reach more. We can get funding. If things get passed, then we can get money to pay people so they can stay there doing their work instead of having a volunteer show up randomly. We can't keep pushing our people to volunteer to help on the weekends. It's not fair. It's not sustainable. And that's the reason I think Maryland hasn't advanced, because we've never been organized. It's always been favors. Oye, ¿puede venir el sábado? Yeah, we'll all help once or twice, but we're not getting continuity because there's no funding. People can't survive on favors. So I see a lot of chatter on the chat. I would like to ask everyone to please make sure we have your name, number. Make sure you're a member. Become a member so that you can get all of our communications. I can't send personal emails every time. I have tons of people. Acuérdame, mándame la invitación. We don't have the bandwidth for that. So become a member, invest in us like we're investing in you, and then speak up. I mean, Carlos and we have Kelly killing it I mean, God, if this is our future, it's feeling pretty good. So let's make sure we're shoring them up. So bring your suggestions, show up for testimony, ask for letters of support. And if we're missing something, because look at this, you're hearing this, right? Housing, education, immigration, it's a lot. Please let us know. And remember that the work happens by priority. So if we're not necessarily talking about food safety or food stability, it's not that we don't think it's important. It's we have another crisis and another fire over here. So there's a lot going on. But Gabriela, you can open it up to questions. I know we don't have a lot of time and everybody's introducing themselves. So thank you guys so much for that. And the information on membership, we'll make sure we put on the chat. Gabriela, again.
That's what I was looking for.
Pero Gabriela.
I got it. I'll add it to the chat.
Beautiful.
Oh, thanks, Heather. So
Beautiful.
yeah, we're, this is actually I do want to open it up to you. Where is everybody's at? Y'all put some really amazing comments. Feel free to raise your hands and we'll and unmute yourself and share. I noted so many of you.
A lot of new friends, a lot of new faces.
A lot of new friends, and this is great, and that's what this year is about. Send membership link to, okay, will do. That's great. Yes, actually, that's what this is about. The policy series is all about us joining together on issues. Judging from the chat, I think we have some commonalities here. Hunger, challenges, behavioral change, gambling, I saw, preventing gambling.
We have a question.
Addictions. Oh, go for it, Carlos.
It's Mr. Knight.
Oh,
Mr.
hello.
Knight.
This is my first meeting. We actually joined Maryland nonprofits last year, and initially I was in during the pandemic. Right now we're in Puerto Rico, so we're learning more about you. Our mission is to create awareness of the ongoing needs of Puerto Rican citizens with a vision that these needs will be provided to all citizens on the island. That's the quick part of my first my elevator speech that I give to people. But I really appreciate the opportunity to get the email to hear more about what's going on. I met briefly with some folks at the December party, but we just haven't, we're just getting into this. While we're in Puerto Rico, well, the weather's better here, but the good part is that we've handed out 4 checks in the last to less than a week to very worthy people, and I just appreciate this meeting, and we thank you. I'm glad that you sent me the link so that I could find out more about what's going on with Latinos Unidos, and it won't take more time, but I just thank you very much. And
Thank you.
I appreciate, please send me whatever you need to, whenever you need something, just send it to my email and I'll see what I can do about responding. Thank you.
Careful what you ask for, Mr. Knight. John. I love Puerto Rico. I grew up on the island. I'm Mexican by birth. My family's Mexican, but my father took us there when I was about 6 months old. And so I am, I may not be island born, but I am definitely island proud. Yes, Carlos.
I'm so sorry. I saw a question from Angela Hernandez directed to me about our education bills, your handout you shared. Are there specific ones that you sense may have the greatest traction and can most benefit from our respective advocacy? Now, I'm seeing this question a lot as to what do you think the winner is, the traction element to it. And I have to tell you, from my time working with them, with these Republican and Democratic senators, it's not so much that you can gauge which one's a winner as much as you can gauge what alliances are swaying these leaders to vote. And once you can gauge that, and how do we make that happen? And I appreciate all these calls for support, but with this initiative that I'm trying to roll out, these reels, these videos, we are seeking to educate the populace on these bills, providing that background information to make sure that we don't repeat these errors of the past that we've done. So if and when MLU shares them, if you can share them to your networks and we can educate our community, and like Veronica said, it's not to be biased, it's not to be Democratic or Republican. We need to reinvigorate the idea of conversation. And it's being lost in this day and age. And I don't mean to preach. I'm just speaking in terms of this is how we really get these laws and this legislation passed, by becoming that force that these representatives know that, hey, you know, if MLU is behind this, that means that they're bringing a united front with them. So that's just how I answer that traction and who I gauge as the winner. Just real.
Yeah. Well, it's at this point, you know, oftentimes it's like I feel we have to build our own momentum, right? I think that's what we're all trying to say. And you know, our motto is "Juntos podemos más," together we're stronger. And we lead with that. And as you've heard from Kelly and Veronica and Carlos and myself. So we're almost to the end here, 4 minutes. Does anybody have any burning questions or anything they'd like to add? If not, I will hand it to my dear Veronica. By the way, Veronica, for those, because there's so many new folks, I didn't introduce her. She's
Sorry.
the co-founder.
May I pop in here for just a moment?
Oh, there you
Hi,
are, Heather.
everyone.
I didn't see you there. Okay, hi.
I
Yes.
just wanted to say I'm Heather Iliff, President and CEO of Maryland Nonprofits, and I just wanted to acknowledge and recognize 2 birthdays this week.
Oh, no.
Both, Gabriela Livas and Veronica Cool are celebrating birthdays. Forgive me as I'm not a Spanish speaker, but I'll say Feliz Cumpleaños to you, and just want to uplift both of you for your this great life milestone and all the amazing Maryland Latinos Unidos milestones. So congratulations.
Thank you, Heather. Thank you, Heather. Thank you. Dale, Gabriela, ¿qué ibas a decir? I know.
I was going to say, knock it out. It's your turn. Let's talk a little bit about our breakfast series that's coming up, and membership and all your plans.
I was going to go into that. Thank you so much. And thank you to the steering committee members that are on the call. I see Maria Pilar Rodriguez. Saludo, mi hermana. Saludos, saludos. So yes, my birthday, it's 50. I'm turning 50 on Saturday, and I'm so abusing my friends. And instead of birthday gifts, I'm demanding they fund Maryland Latinos Unidos. That's how important this work is. We started 3 years ago. We co-founded the organization because we wanted sustainability. We wanted permanence. We wanted legacy. We wanted legacy. I can't say that enough. It doesn't have my name on it. It doesn't have Joceline's name on it or Elda's name on it for a reason. This is for us. We want this standing in 50 years. So with Gabriela and the staff, they've created this fantastic policy series. We're going to be rolling it out. It'll be 4 in-depth sessions throughout this year, addressing these very, very complicated issues from the perspective of our community and the need for equity, the need for access. We're going to be tapping a lot of you, our subject matter experts, so that we are representing our community. Our entire organization is built from the ground up. It's you guys in our committees. It's you guys in our various summits and workshops. So please raise your hands and get involved. We're also seeking sponsors, exhibitors, partners. So as you're getting the information, please step up. Please step up. When we're together, we actually work magic. When we get together and we go to legislation and we push for a seat at the table and access, we get it. A lot more powerful than just one of us showing up alone. So this is really about strategy. This is about making it better so our kids, our grandkids, our kids that are graduating have decent jobs and decent income and have pay equity. We're also celebrating the loss of Roe versus Wade, right? So if we don't speak up, we're going to continue to be impacted. And as you guys know, Latinas are at the lowest rung of pay equity. The last number I saw was 57 cents on the dollar pre-COVID.
Well, the Equal Rights Amendment is coming around. We need to think about that.
Correct.
I'm slightly biased.
There's going to be a rally with the Women's Caucus on February 8th. No, we have to speak up because the last number I saw is below 50 cents. So a Latina female gets paid less than 50 cents on the dollar for what a white man gets paid. And you know, we do the work 3 times as faster and better. Not biased at all. Pero el punto es simple. Because we're not organized, because we're not together, this will be perpetuated. So I'm done. For my 50th, my second showing, my second halftime, I'm done playing. I'm done playing. We don't have the capacity to be tortured and stepped upon any longer. And the only way we fix it is by joining forces. So for my birthday, for us, please get involved. Please show up. Please contribute what you can. Please become a member, but please speak up. It's about us. It's about building that legacy. So in 15 years, we're all sitting somewhere drinking un cafecito. We're going to remember how we did that? Because we did. We have done it. We will do it. So I hope that for my birthday, for Gabriela's birthday, we make this a continued success.
Thank you so much, everyone. We so appreciate you for being with us. It is now 10:01. We try to end on time. We appreciate you. We want to just get lots of different allyships and collaborations going and continue the ones we've already started. I feel that Maryland is a model for the rest of the country in lots and lots of ways. And so we stand proud as Latinos and Latinas, but also just as Marylanders. So have a great day, guys. And we look forward to engaging in the next days to come. And think about our summit that's coming up. You just heard, or it's not a summit, it's our breakfast series of 4 events that Veronica made. We'll make sure you get that information, but you've heard it here first, folks. Have a great year.